Hi, I'm Danielle.
I'm Caitlin.
And we are Our Time of the Month.
And today we are here with Dr. Joy Noble, who is going to help answer some questions about a variety of feminine issues. Feminine and also everyone issues.
Yeah, everyone issues.
But we've got pee, poop, sex, general medical questions, your physical health,
contraceptives, menopause.
Yes. These were all submitted via Instagram. We opened it up, and so we received a lot of questions. I want to say thank you, first of all, to everyone that was willing to share their question. These will all be anonymous, so we won't be calling anybody out.
No.
Would you like to introduce yourself?
Absolutely. So I'm Dr. Joy Noble. I'm a physical therapist. I specialize in pregnancy and postpartum, also treating patients with a variety of pelvic floor dysfunctions, transgender patients going through gender confirmation surgery, and then I also do dry needling, which is kind of like the fun little thing I sprinkle in there. So if you have questions about any of this, these are some great resources. I hope you find something interesting.
And we will leave all of Joy's contact information below. If you're in the Baltimore area and you want to see her as a patient, where can they find you?
So I'm in Vision Fed Hill on West Montgomery Street. You can just go to my website and all the information you could possibly find is there. Lots of frequently asked questions too.
Great. So if you're looking to contact her, feel free to look down below. We'll include all of her contact information in the description box.
We have so many questions that we need to break this up into multiple videos, so this is going to be a bit of a series. Stay tuned if you want to see the other topics that we have to speak about, but today, in this video, we're going to talk about pee, poop, and pelvic floor.
Honestly,
The new 3 Ps. It's no longer pits, pussy, poop hole. Pee, poop, pelvic floor.
honestly, these are things that we can't talk about constantly.
Yes.
So it could not be more fitting. Why, as a 28-year-old without children, do I pee each time I sneeze, and can I do something about it besides Kegels?
Yes, always. Kegels are not for everyone. So,
Oh.
yeah.
Learning something already.
Honestly, 2 minutes in.
Yeah, not everyone needs to do Kegels.
Okay.
So, 28, no kids, why would you pee? You could have a weak pelvic floor anyway, so not everyone has a strong pelvic floor. Or your pelvic floor could actually be too tight. So I talk about this, like, imagine holding on the monkey bars, right? Eventually you're just gonna drop because you can't hold on anymore. So your pelvic floor can do the same thing. Those muscles actually stop holding the urine in and you can have a leak because they're too tight.
I
Wow.
learned so much today.
It's a lot.
So what kind of, is it therapy? Is it physical therapy that you would do to strengthen the pelvic floor?
Yeah, so Kegels are going to strengthen, but
Okay.
I would say, you know, see a physical therapist to assess the muscles, like figure out, are they tight, are they weak, what's going on, and then go from there to address it. But at 28, you should not be leaking pee when you do anything. Sneeze, cough, exercise.
And I guess actually, so one of the questions that I would immediately have is, what does an appointment when you see a physical therapist for pelvic floor issues, what does that look like?
You're going to do a thorough medical history. So there's so many questions. I feel like for everything you submitted, it's great, but there's so many like follow-up questions I have.
Yeah.
So a lot of history just to see kind of where are you at, what's going on. And then after that, we're going to take a look at your low back, your hips, your pelvic floor. And so the pelvic floor is the best part. Basically think gynecology exam without the speculum and without the stirrups, put your feet in. So we're going all up in there.
Oh, you
Okay.
are?
Oh yeah.
So that's what I assumed, and I figured that's probably got to be like a scary part for a lot of people to
Yeah.
think like this isn't a gynecologist, you know, it's
Wow.
a physical therapist. They're not supposed to be there, like all of that kind of stuff. So yeah, I think
We go right up in there.
be ready and prepared when you're going into that appointment, knowing that somebody will, and like know that you feel very comfortable with the person that you're seeing because they will be in your most intimate areas.
Yeah, absolutely. But the thing is, like, we do this all the time.
Yes.
Right? Like, this is gonna be really bad. I've seen a lot of vaginas in my
No,
life.
see, I love that.
So, like,
Lay it out there.
I tease my husband about that. I'm like, I've probably seen more than you have.
For sure.
But the thing is, so, like, we're so used to it. Like, this is so normal for me. Talking
Right.
about this is exactly what I love to do. So don't come in thinking, like, oh, she's never seen something like mine
She's
before.
gonna judge me.
Oh no, see, that's why you're going.
Oh, no,
You're going
yeah.
to see the person that has seen this thing before.
Yeah,
Right.
Lots of it. So it's...
Ooh, yeah.
If they haven't seen a lot of vaginas, find a different one.
I have very ... stale smelling pee.
Yeah.
Yes.
That is the best way I can describe it. There's no discoloration or foul smell, but it doesn't smell normal. 0 symptoms of a UTI and or STI, OBGYN is stumped, all test results have come back normal. I can flush it out of my system by drinking lots, but it always comes back. This has been happening for 3 to 4 years. For the first time ever, I smelled it after sex, which really alarmed me. Perhaps some pee came out during intercourse, but no one can figure out what's happening to me. Please help!
Really good question.
Have you heard of this?
Not specifically.
I want to know what stale smells like. Like,
I feel
I was thinking
all
like
pee
coffee
smells
pee,
stale.
like That to me smells stale.
Unless it's like the thought of like pee in a bathroom, like you've gotten like a dirty like like that could be like pale like pee that sat for a while. Like think of like stale bread sat out for a while. Like,
Yes.
that's all I can think of.
And if she can flush it, but then it comes back.
But that makes me think that you're dehydrated.
Yeah.
Right.
Like if you flush it with water, and that's kind of the thing is like looking at the scale. Like there's a pee scale. You can go Google what color should my pee be, and there's a scale of like super light to dark yellow, not good. And that would be my first thing is like you should be able to keep it flushed with water.
Okay.
Right, and like what color is her pee would be my question too.
Right.
And she says no discoloration. The other thing I would consider is like what's no discoloration. So I talked about this with a patient yesterday who we talked about pee color, and she's like, oh no, mine's like bright yellow, and thought it was normal.
What?
Like so that's the thing. You say no discoloration, but what does that really mean? So
Shouldn't
look
your
at that
pee
scale.
look kind of like this?
Like a little like closer here, a little lighter.
Okay.
Yeah.
I think I had 3 ice cubes. 3 ice cube white wine, not 2 ice cube white wine.
That's your scale. So yeah, so when we think of discoloration, also consider what medications you're on and what supplements you're taking. So B12, I believe, is the one that will definitely like up the color, make it a little more orange or yellow. But otherwise, yeah, if you can flush it out with water, drink more water.
I'm starting to experience stress incontinence, which I personally didn't even know could happen. What steps can I take to reverse it? And then I'll do a follow-up. Does weight affect urinary incontinence?
What do you mean you didn't know it could occur?
I didn't know that stress incontinence could occur.
Okay, so we'll start there.
Okay.
Yeah, I didn't even know that was a thing.
There are 3 types of incontinence.
Oh. I just thought it was incontinence.
No. So we can incontinent pee or we can incontinent poop. So that's a fun. Yeah.
Oh. Is that sharding?
So with incontinence, you can have stress incontinence.
Okay.
Coughing, laughing, sneezing, jumping, exercise. You can have urge incontinence. It's like really strong need to go to the bathroom and don't make it on time.
Okay.
And then you have mixed, which is just the 2 together.
So I think Caitlin and I were thinking stress, like when you're stressed,
Yes.
you're peeing.
Okay, now I understand. I
Me
was
too.
like, okay.
Oh.
No, that's what I thought it was, and I thought
Stress
like,
on
I
your
didn't
body
know.
incontinence. I get it now. Oh, makes so much more sense.
But see, this is so normal.
Yeah.
Like that, like mentality of being like, oh, that's what that means.
Right.
Like that's why you see a pelvic therapist, because we can help explain like this is really what it is, and it makes a lot more sense.
Right, it's like incontinence caused by a stressor, aka like a physical thing.
Jumping.
Exactly.
Hopping.
See, look at that.
So, what can you do to reverse it? Find out how strong your pelvic floor is. So figuring out, is your pelvic floor weak? Is that what's causing it? Are the muscles too tight? This kind of goes back to an earlier question. And then work to address that. So if there's weakness, strengthen it. If there's tightness, calm it down. And then work on breathing. And breathing's gonna come up a lot. So breathing is so key to help take the pressure or the stress off your pelvic floor. And then can weight play a role? Yes, absolutely. So weight's definitely a big factor. If you think about your bladder is a water balloon that you are just holding the bottom. So you haven't tied it off, you haven't done anything, you're just holding the bottom, and you just keep adding like another book and another book and another book. Eventually you're not going to hold it. It's just going to come out the bottom.
Yikes.
Wow. Oh my
Yeah.
god, I like have to pee right now.
I know.
Even
all
though I
this
know
time
I
not
don't. I
peeing.
peed right before you came, but
It's the power of suggestion.
Uh-huh.
This is just
For
in case
sure.
voiding. Don't do it.
mine is I'm a nervous peer. If I perceive that I will not be able to access a bathroom for one reason or another, I have to go before I do it. Otherwise, I literally build it up in my head. Like before a massage, before I get in the car.
So that's called just in case voiding. That's when we go to the bathroom just in case.
I do that.
That's got a name.
Yeah, it does.
I'm a just in case voider
Yeah.
all the time.
It's not good. Don't do that.
Well, my life's
really?
motto is never pass up an opportunity to pee.
Yeah, it's not good.
Really?
Yeah.
Oh, because it's like your body gets used to peeing all the time instead of.
Oh my
only
god,
peeing
that's
when
what
you
I'm
need
doing to
to.
myself. I'm convinced that I have a UTI, and my doctor's like, you don't have a UTI. And I'm like, nope, I have a UTI.
Yeah.
No, I'm just encasing.
You're just encasing.
So I just gotta stop.
Yes.
Fight the urge.
Yeah. So you should be able to hold like 2 cups of urine in your bladder.
Oh yeah, because when I'm going, it's like nothing.
Yeah, that's a problem. So here's how I explain it. We're gonna like super our time of the month this. If I give you both $1
Yeah.
and you go spend it, you're going to the dollar store to get makeup.
Okay.
Right? So you're getting like
Lipstick.
shit makeup.
Yeah.
But if
Garbage.
I keep giving you another $1 and another $1 and another $1 and eventually you have like $100, you're going to get much better makeup.
Mm-hmm.
So if I give you a little bit of pee and you go pee, you're going to be like, not really satisfied, but
Yes.
I got it out of there. But if I let you build up till you got like a full, like an actual full bladder, not just telling yourself like I'm going just in case, you're going to be so much more satisfied with
I never
the pee
feel
that comes
satisfied.
out.
I love this. This is my favorite conversation I've ever had. I think.
I just, who even knew?
Yeah.
So, like, even
Us,
right
we
now.
did not know, but she knew.
I have like that tickling feeling
Yes.
where I'm like, I need to pee, but I know I don't need to.
Right.
So just ride it out.
Yeah, it's because we're talking about pee.
Yeah.
But there was a question on here which was, how long should I be able to hold my pee?
Right.
Because I feel like once I break the seal, like a night of drinking, for instance, every 15 minutes I'm peeing.
Yeah, absolutely.
Why?
Okay, so that's two parts.
Sorry.
No, you're good. No, that's good. These are good things. So you should be able to go like every 3 to 4 hours.
I'm not.
Wow.
And it should be, again, like, it should
Not
be like
doing
10 to 15 seconds of peeing. Like, true seconds though, not like 1, 2, 3, 4, 5, 6, 7. Like, but that's like a full void.
Okay, 3 to 4 hours.
3 to 4 hours. If you're under like 75, you shouldn't pee at night either. Like, when you wake up at night. And the...
Oh, God.
Yeah.
Wait, I'm supposed to go back. I'm just supposed to be like, no, go back to
Yeah,
bed.
just go back to sleep. I mean, if it's really gonna bother you,
Right,
get up
right,
and
right.
go. But like, normally you
What
shouldn't
if I
have
wet
to.
the bed?
Yeah, it is funny because I do know that there was a period of time where I was waking up to pee every single night, and then it stopped. But I knew
Wakes
that it
up
wasn't
to
good
pee
because I
every
felt
night.
like it was training my body. Yes, you can pee now, exactly like a dog. Like when you're potty training a dog.
So then we go into drinking, and then we think of things like those are irritants to the bladder.
Okay.
And that's why we end up that
Alcohol.
way. Yes, alcohol, caffeine, tomato, citrus, artificial sugars, carbonated beverages, which means all of our like
LaCroix.
Trulia, White Claw, LaCroix lovers.
That's the
Wow.
culprit.
That is like, you're really pissing your bladder off because you're giving it so many things that it hates, and then you're gonna pee all the time.
Yeah, and you're also just consuming more liquid
Yeah.
than you would like
Yeah.
if you're out drinking. You're never drinking that much, just like at your desk at work, as you are like at a bar.
I try to drink a lot of water.
So this person asked, why am I leaking urine after my hysterectomy? I'm 3 weeks post-op now, and the doctor says it will improve. Is that true?
Yeah, it should. I mean, you've been through a surgery, so you have to figure out what approach did they do, where did they go? Did they go vaginally or did they go through the abdominal wall? And then from there, it's just kind of like post-op healing. Like swelling's got to go down, things
Right,
like
I
that.
feel like 3 weeks
feel
isn't
out.
enough time to heal. That's a major surgery.
Yeah.
On average, what would you say the recovery period, and this is like, obviously it's person to person, but on average, you would think you'd be sort of like back up and running and sort of back to normal, you know?
Yeah. I mean, like tissue healing is 6 to 8 weeks.
Okay.
Oh, wow.
So 6 to 8 weeks is like things are healed, but then you have to think of for 6 to 8 weeks I haven't done all these things.
Right.
So then you have to let yourself have time to get back into all these things. So depends on what you want to do. Like, do you want to be able to sit on the couch and read, or do you want to go run a marathon?
So at what
It's gonna
point,
take you a while.
at
Option
what
one,
point do you think
please.
she should be like concerned that she's still having these issues?
Good question. Like 6 to 8 weeks after surgery, I'd say if things are still not improving at all, see a PT. That would be my thing. And I will throw the laser question in real quick. I've heard of laser treatment for the bladder control. Thoughts? To do what? Like, what is the laser doing? I feel like that's an easy, like the cop-out, like treatment of
Like a
an
band-aid
issue.
and not a fix.
Yeah. So I'd still say go see a PT.
Okay. So, pee aside, we're moving on to Caitlin and I's favorite topic.
There's nothing that we want to talk about more than poop.
We talk about it all the time. Are poops that float okay? Well, an egg that floats is a bad egg.
And a poop that floats is a bad poop.
Okay.
Is it like not filled with nutrients or something?
It has too much fat in it, which means your body didn't absorb the fat. And your body needs fat to help break down things like carbohydrates. So
Oh. So, in
not
the
good.
long run, what would this person perhaps be seeing other than a floating poop? Like, would they be feeling any certain way? Weight gain, weight loss, anything like that?
that's a really tough answer.
Okay.
I'd say talk to a medical doctor.
Okay.
Just because you have to consider how the malabsorption, the not good absorbing of fat out of your diet that you need, like you need good fat, how it affects your body. It's not good.
What would be some of the causes of floating poops?
The fat content in the poop is too high, so your body's not absorbing that. So you have to figure out why is my body not absorbing it.
Okay. So could it be
So-
that you're either eating too much fat or that it's
be.
not, what would cause it to not absorb correctly?
What about someone like on a keto diet because they eat so much fat? Do they have floating poops?
I don't even know. I don't
people-
know
2 people, 1,000 questions.
I know about a floating poop.
Yes.
I
just
don't
so
know.
funny
That's a
to
good
me.
question. Maybe.
So then what is a healthy looking poop?
There's a chart for this.
I know. I've seen the chart.
Me too.
It's going to either be well formed like a Snickers bar to still slightly, like you can see some different like lumps in it. If it starts looking like rabbit poop or dog food, it's too too lumpy, too hard. And if it's really runny,
so I've often described my little rabbit poops as reindeer turds. That's like my official term for them. And every time I have a reindeer turd poop, it is not a satisfying poop. I feel like I'm constipated.
You are constipated. 'Tis the season.
So what causes a reindeer poop?
Constipation.
Constipation.
Yeah, so as poop moves through your bowel, you're taking water and nutrients out of it.
Okay.
Thusly, if it has too much fat, you haven't taken enough of the fat out of it.
Okay.
If you are dehydrated, which is why the annoying question of have you drinking enough water?
Yeah.
As your body is taking water and everything it wants out, the stool gets harder and harder and harder.
Okay.
And then as it gets harder, it's harder to get out.
Okay. I feel like when I do poop lately, it's been healthier. I always heard, I don't know if this is true, but the sign of a healthy poop is also that when you wipe, there's nothing on the tissue. And I have a lot of poops like that. So is that good?
That is good.
Okay, good.
Yeah.
Yeah, I'm not that way. I have a lot of poop problems.
Well, I was that way for my whole life.
Yeah. Well, you were the opposite way though, because you were
I never pooped.
You were constipation.
Yeah.
And I skew soft poops.
Well, then when I had SIBO, it was like diarrhea every day.
Yeah, pretty much.
Yeah.
Does sharding happen more as you get older? Is it normal? Do I have IBS if this is happening to me?
When we think of anything you'd see a pelvic floor therapist for, like if it's a bone, a joint, a muscle, ligament, a tendon, like the things that make your pelvic floor, we can help.
Okay.
So I have to look at it like, is it your muscles getting weak and that's why you're sharding? Like the muscles that wrap around the anal sphincter, are they weak? Or are we having more of like, we're loose stooling and so
It could maybe a diet issue.
Could be a diet issue. We're gonna get real fun real quick. The other thing to consider is any kind of like anal sex.
I was gonna ask. Oh my gosh. Okay.
That's another component. Like if that is a part of your sexual experience, then you have to consider, is your anal sphincter too stretched out and you're not strengthening it appropriately to help prevent this issue.
Do Kegels work for the sphincter as well?
Yes.
So it was funny though, I saw a TikTok the other day and a woman...
We learn everything from TikTok.
I will say, I've learned things from TikTok, but this one, she was making fun of girls who do Kegels. She was like, bunch of you bitches don't realize you're just over there squeezing your butthole.
But you're supposed to squeeze your butthole.
But she was saying like, a lot of women aren't squeezing appropriately. Are we all squeezing now because I'm talking about it?
I'm
I
doing
feel
it
you
like
have
over
to.
and over and over again.
Well, you'd have to
No, because I talk about it all
I
the
was going
time.
to say, if you squeezed every time you talked about it,
I would.
you couldn't get anything in there. But because she was talking about just like how most women aren't squeezing the appropriate muscles and they're just tightening their butthole. And I was like, oh my God, that's awful.
Along those lines, I watched a TikTok where a guy was like, yeah, ladies, you like it when we make our dicks bounce? That's us puckering our buttholes.
Wait, what?
He's not wrong.
When they make their dick do that, it's because they're...
Squeezing. They're doing a Kegel.
They are.
Yeah. Inconsistent bowel movements. Sometimes a lot, sometimes a little. Consistent diet, no meds, but bleeding when moving my bowels. Not every time and not in the stool, just on the paper when I wipe. Is that a hemorrhoid?
It could be, actually. That like didn't even pop in my head. So if you have inconsistent bowel movements and bleeding. So bleeding makes me think a couple things. Yeah, hemorrhoids. Hemorrhoids could totally be it. When your stool's too hard, so this goes back to our constipation stuff, and if it's too big.
Sometimes I have a shit that I'm like, how did that come out of my butthole?
Well, I have had like a hard, large stool before and like had a little like red on the tissue. But for me, I knew exactly what that was. I was not concerned.
Yeah, so that can be it. And then that your sphincter, your muscles and tissue just stretch so far that you get tearing.
Ooh.
So if it's light pink or even some bright red, like that's a new tear. Like that's new blood.
What would not be new blood? Would like a deeper red be?
Think of your period. Like darker blood, browner blood, darker red blood. That's older blood.
Okay.
Yeah. So you say like consistent diet, no meds, but now we have to think of like, again, hydration and positioning. So squatty potty, everyone should have one.
Okay.
Someone was trying to sell a used one on Nextdoor and I was like,
No.
I'm gonna buy a new one.
They're not that much.
Right?
Yeah. They're just
not
on
at Costco.
So put yourself in a good position to be able to have this bowel movement without making yourself bleed.
I used to like my old bathroom because the tub was in front of the toilet, and I would just put my feet up and slides right out, tell ya.
Oh, it literally does. Like, the muscle goes from here, like, shit's not going anywhere, to like here.
Right?
All the way down.
It's like a laundry chute for your poop. The poop chute! Literally, it's a poop
Literal
chute.
shoot. Painful poops.
Oh, painful poop.
Yeah, so if you have painful poops or pain in your abdomen with pooping, it's all the same, really. Like, water. How much water are you drinking? What's your diet like? What's your fiber like? Which, those are the annoying questions. That's what everyone asks.
I think I used to eat too much fiber.
Probably. Well, and there's soluble fiber and insoluble fiber, and one will help with constipation, one helps with, like, loosening your stool, one helps make it a little bulkier.
Yeah. Because I think I was overdoing like leafy greens.
Yeah.
Overdoing roughage. I think that was one of the reasons I was having so much poop. Just all the pooping
I think
all
that's
the time.
easy to do.
And it also, I was having a lot of grumbles, like very loud, like
She calls them whale calls.
Well, yeah.
Oh, they are whale calls.
Yeah, that's exactly. I feel like I'm on, or like a
You're in
like a
Finding
National
Nemo.
Geographic safari, like in the distance, like all of that, and it's usually in my like lower left.
There's actually a massage for that.
Oh my god, yes.
And it's called I Love You Massage or ILU Massage. And so because we go from our stomach to our small intestine.
Yes.
And then it goes up our right side, across our body, and down our left side.
Yeah, you make
an
ILU.
Like the left side is where it's like
Depositing.
That's why you know you're gonna have terrible gas in like a little bit.
Yeah.
My doctor that I've referred you to told me if you don't feel like you can massage it, have your partner massage your stomach.
I forgot about that. Okay,
Yeah.
so wait, so what type of...
So you're just making little circles. Start at right under your rib cage because that's stomach. And then we're gonna go down to your belly button and pubic bone because we're getting to small intestine.
Oh, I have another question for you later.
Go over to the right. Go up, across, and down. Unless your insides are backwards, in which case just reverse
What?
that. Yeah,
What
but-
Whose
percentage of
insides
people?
are backwards?
I don't know. It happens. Yeah, we're in PT school. Like we do cadaver dissections, and occasionally we get a body, and you cut it open. You're like, oh,
But it's not
the
that...
heart's not supposed to be like everything's flipped backwards.
But we would know
But it's not that
that by
uncommon.
now. Like if
Yeah,
we've had
by
CT
this point,
scans and
yeah.
stuff like
You'd know
that.
if you're backwards. So yeah, if you know you're backwards, just flip it the other way.
What?
If you're backwards, leave it in a comment
Yeah,
below. I
please
want to
tell
hear all
us.
about
Oh,
it.
I would love to know.
We're on to pelvic floor.
Okay, this one. I'm always scared I'm doing Kegels wrong. How often do I need to do them and for how long?
And also, let me tag one on there. How do you do them? If she feels like she's doing them wrong,
Good question.
can you show us?
Right.
Let me just take my pants off. If you're under 18, please
Right.
stop
Click
watching
away
now.
from this video.
That is the number one thing people see me for.
Kegels?
Like they'll come in because they're like, I just don't know if I'm doing them right. Like, can you
Oh.
tell me? So if you don't know, we'll check you.
Well, actually, what percentage of people are doing them wrong, you think? That are coming in?
That I've tested, 90%.
Wrong?
And like,
Okay.
like then we have a spectrum.
I'm in.
Like how wrong are we talking? Like some like got the initial like they got the gist of it, but then they start cheating too much. Okay, we can correct for that.
Cheating.
Yeah, there's cheating. And then some
I can't wait.
I'm not even sure what they're doing.
I'm
Like,
gonna make
try
my
this again.
puss so tight.
Okay.
Muscles, whatever.
And
So-
then you'll end up with pelvic pain. Don't do that. And they'll
Okay.
see me for another issue.
Okay.
Okay.
So
So,
there-
You're
There's,
gonna make
like,
it appropriately
Goldilocks.
tight. Yes. Not too hot, not too cold, not too weak, not too strong.
okay, Goldilocks
Okay, I'm
of
ready.
You want it just right.
Yeah.
strength.
I do want it just right.
Okay, so we're sitting.
Okay, so sitting.
Is that how you're supposed to do them?
Oh, every position.
Oh, because everything's different.
Oh my
Yeah,
god.
Laying down, sitting up.
I need to budget
standing.
time into my day for Kegels now.
No, it's
Like,
just
what are you doing with your one leg up over there? Hold on, I'm Kegeling.
One
Oh, yeah,
leg?
one
No, I
leg
was
up.
making it.
Oh, okay.
You know.
Full spread eagle.
What do you like to do?
Full spread. I've never tried it full spread eagle.
Okay.
now.
That'd be really hard.
Yeah.
But we think we're doing it. But I bet we're
I
not
know,
doing
now
it
I'm very
right.
concerned.
You probably are. So if you're sitting here doing your Kegel, life is good, right?
Okay.
Like no one knows.
Right.
Yes.
If you start to cheat, you're gonna lift up off the chair
Oh, I don't ever do that.
because your butt is kicking in.
Who's doing that?
Oh.
Lots of my patients.
Yeah, see,
Lots
that's the
of
thing.
That's like a lot of leg and butt
Mm-hmm.
muscle.
Yeah.
Oh, that's not at all right.
The big thing I'm looking for first is what's your like mental trigger. So sometimes I'll say try to stop the flow of urine because if you're coming to me and you're like I pee all the time, I like pee in the middle of whatever, like
Okay.
you're
Yes.
so terrified of peeing.
Okay.
So if I say try to stop the flow of pee, your brain's like, yep,
Yeah.
I'm gonna try.
That's
Okay,
that's
done.
like that middle part that was right. Like if I try to do that, that's
right, it's
there.
like sucking it in, kind of.
Yep.
yeah.
Yeah,
Well, it's,
kinda
it's almost more like a like
Or we go with trying to stop the flow of gas because others are terrified of that.
Gas?
Like not farting in front of other people. So they think of trying to hold in like a bowel movement or hold in stool or farting. That will help kick in the backside.
Should we be holding in farts?
No. Why? It's just a normal function.
Yeah, I agree with that.
So it's an elevator. So you're like, it's an elevator. So then you're closing your elevator doors and then lifting them up.
Ooh!
Yeah. So like you're in the lobby. You need to be in the penthouse.
Yeah, like I will.
Join the party.
That's shoving it up the chute. Like that's my face when
It's
I'm trying
like
to
sucking up a turd.
Like if I could, I'd be doing it right now.
Or picking up a blueberry.
With your butt?
No, not your. I mean, you can. Yeah, absolutely. This one always gets me. I think because I don't like the word slurp.
Oh, I do.
Like I'm okay with moist and panties, but slurp gets me. But you can think of trying to like, we'll go with suck. Suck the smoothie up a straw. That's another way of thinking about it.
That's the thing I'm
Slurp,
trying to say. Like I'm sucking it back up. That's I'm slurping.
Yeah.
Ew,
Right?
ew,
See?
ew. I don't like it in relation to
I don't like
slurp.
Slurp.
Yeah, no, I don't really want anything
yeah.
slurpy down there.
Okay, well that's what we're doing.
That's a Kegel.
Every day for how? So for like
That's
how
what I was
long?
gonna say.
The goal is 10 times 10 seconds.
Oh.
Like you should hold it for 10 whole seconds. Holding.
Huh? Oh, I don't do that. I
Yeah,
just pulse,
yeah,
pulse,
well.
pulse.
Worthless. Years of Kegels down the drain.
Not down the drain.
I know.
Oh
this
my
is good
God.
stuff. But we just now have a new challenge.
Okay.
10 times 10 second holds
We're gonna
without
have to be checking in with each other.
squeezing your butt, without squeezing your thighs. This is when people start doing this because they get tired after a while.
Oh.
Or without holding your breath.
Oh, and breathe. Yeah. Because I definitely, probably hold.
Yeah, it's harder.
It's
to hold for 10
harder.
seconds. And then you can do 10 quick flicks.
10 quick.
That I'm good at.
Yeah.
I got
I got hummingbird wings down there.
Okay, just because I don't know what this is, I have rectocele. Is that how you say it? I am 6 months postpartum. Will basic, what's PF?
Pelvic floor.
Oh, pelvic floor, duh. Will basic pelvic floor training help this, or will it never fully heal? What's rectocele?
Are you ready?
Is it with your rectum?
Yes.
It is with your rectum.
Did it rip when you had a baby?
No, it did not.
Okay.
No.
What happened?
I don't know if it's better or worse than that though.
Oh no.
So a rectocele is a prolapse.
Oh.
Is that when it like comes out external?
Yes.
Oh no.
But it comes out externally through the vagina, not through the rectum.
What?
That's an anal
What's
prolapse.
What's coming out of your vagina?
It's rerouted. It's rerouted.
No. Anal prolapse is out the butt. Rectocele is when your inside vagina comes outside.
Because of your rectum.
I didn't know that could happen.
We'll go model on this one.
Yes.
Okay, yes, please bring the props.
So, this is your pelvic floor. So, this is vaginal canal here.
Okay.
Rectocele is when the rectum is pushing on this wall, and what you're actually seeing is the vaginal wall come out.
But because of your
rectum.
Wow.
This is occurring if you find yourself wanting to like stick your finger in the vagina to push the wall back to have a bowel movement. Like that's a common
what they
occurrence.
have to do?
Mhm. Some people do. Or they'll have to push like the perineum, so right between vaginal opening
Right.
and rectum.
The taint.
Yes, exactly.
What
help push
causes
poop out.
rectocele?
Delivery. Yeah, vaginal
6 months
deliveries.
postpartum.
Other things. Other things can cause it. Basically, it's just something out of
was a
place.
thing.
Yeah, it is a thing.
Can it be fixed?
It can be fixed. So,
With pelvic floor exercises?
with pelvic floor training, yes.
Okay.
And breathing. We talked about breathing. It's going to come back. So, with managing pressure, if you hold your breath, you shouldn't hold your breath. You shouldn't push down and bear down to have poop. Now we're back to poop. So, not bearing down. Bearing down will make a prolapse worse.
Right. Right, it's like strain, right?
And pelvic floor strengthening. So, just pulling those muscles in.
Get a squatty potty.
Get a squatty potty. Breathe.
Breathe.
Make that.
Like you're in labor again.
Exactly when you're pooping.
Wow, that sounds Is it painful?
Oh, it can be. Yeah. And it can feel like you have like this like balloon in your vagina.
So I don't have a lot of discharge. The only time it's ever been visible is a couple weeks after my period when I'm ovulating. Is my vagina not a good cleaner?
Here's a backlog on this that I did not put on there. She said that she was watching TikTok videos, and a TikTok genre she got pulled into was girls bleaching their underwear because of discharge.
Oh,
And she was like, that made me wonder, like, oh my God, am I not normal?
Bleaching as in like their discharge makes their underwear bleached, or they were bleaching their underwear to keep it white?
I don't know.
Either one.
Who
knows?
I feel like I've talked to so many friends who don't have discharge.
Yeah, it's normal.
I have discharge.
I didn't for a long time. Like,
Really?
when I was younger, I remember sitting on my kitchen floor talking with my friend about it, and I think we were baking at the time, and she was talking about her discharge, and I was like, oh yeah, I really don't have that. But I do now.
I do.
Yeah.
But it's also not plentiful.
Yeah, it's all normal.
It's all
like
normal.
having it's normal, not having it's normal. Your vagina is a good cleaner.
Yeah.
You're doing a great job.
Your vagina is doing great, sweetie.
Absolutely. 5 stars on Yelp.
I do not wear underwear ever. Is that healthy?
Oh yeah.
It is?
Yeah.
Even though my fucking labia is riding up against my jeans.
As long as it's not painful, it's fine.
It's not painful.
Yeah, it's fine.
It might be why your labia is so ugly now.
My poor jeans, though. And leggings. Discharge every time I take them off.
But you rewear your jeans.
Sometimes I wear them twice.
Yeah, that's the part that I'm like, eh.
Well,
Your body.
my labia. My
That's true.
discharge.
That's true.
But
Like if
can
you
that-
swap jeans, like Sisterhood of the Traveling Pants sit
Right,
here,
like it's already my
maybe we won't
juice.
go that way.
Yeah.
I don't know that rewearing it twice is gonna matter.
Okay.
Like, I think you're
I
good.
also feel like if you have the whole night for it to, like, I don't know,
Dry.
dry out. Yeah.
I could just scrape it off in theory.
This is getting real. You could.
That's true. Wow.
then it's gone.
That might be one of the grossest things we've ever said. And not that discharge is gross, but
Right.
yeah, flaking it, the idea of you flaking it with your hands just makes me
For the record, I've not done that.
Oh,
Yeah, let's talk about that. Cleaning.
Yeah. So don't clean your vagina. You can clean your vulva outside.
I think people have a lot of misunderstandings about the difference between the vulva and the vagina.
Yeah,
Yeah.
absolutely.
Well, because they all
Vagina
call it the
is
vagina.
Internal.
But we're also taught
Yeah.
to call it the vagina
Right.
in school, which is not
vulva
correct.
is everything you see on the outside.
Just soap and water.
Yeah.
Like not soap, sorry, just water.
I was going to
Just
ask you
water.
about
Or like the spray thing.
because I've heard just water.
Get a
Yeah.
bidet, call it a day.
How do you feel about loofahs and washcloths?
For bacteria, for the environment, where we
for your
Here.
vulva and vagina?
They're fine. I wouldn't use a loofah.
I just use
Well,
my hand.
I
Yeah.
do too. I'm a hand cleaner, but I know a lot of people aren't.
Don't put anything in it. Don't buy any washes for it. You don't need
No.
a wash for your vagina.
Don't do
Like
shit.
it literally is. If you don't have discharge or you have a lot of discharge, like it's okay. Don't clean it up.
As
Don't
my
douche it.
sister-in-law
Yes.
says, it's a self-cleaning oven.
Yes, exactly. The only summer's eve should be the douchebags in your life, not actual douches.
Okay,
Whoa.
bring. I like that.
Any recommendations for a more natural way to thicken the endometrium layer? I have an IUD. I'm not looking to get pregnant, but it's currently so thin, 0.2 millimeters, that I'm having frequent bleeding with sex, exercise, and breakthrough bleeding. Doctor wants to do estrogen, but I'm very hesitant. I'm currently taking vitamin E and occasionally taking raspberry leaf tea.
I would first like to ask what that even is, because I don't know.
Which
Same.
one?
Endometrium layer, like what thickness is appropriate?
What is the layer? I don't even know where the layer is.
So the endometrium layer is what is, this is another word I don't love, sloughing off.
Yeah.
Whenever we have our period.
Oh,
So that's
okay.
just like what, so this like dark pink on here, like it is what's coming out of.
So whenever they
The
say lining,
uterus.
like when
So-
people talk about lining, that's what it is.
So your endometrial lining is inside your uterus.
Okay.
And it comes off and is our period.
Okay.
So what's normal thickness? That's a good question. I don't know the answer to that.
Is 0.2 millimeters thin?
I'm a yes. Yeah,
Okay.
from my Google search, we'll be honest. For my Google search
Okay.
of endometrial lining, because that's not within my wheelhouse of like diagnosing a thin or thick one. But ways to increase the thickness of this lining is exercise and increase blood flow.
For this person, why would you want to thicken that layer?
Their complaint is having like breakthrough bleeding with like sex or exercise or things like that. And so it's the, like, no one loves to bleed. So having exercise, having increased blood flow is going to help. And estrogen, unfortunately, can help make that thicker. Other things is cutting out the fun stuff like caffeine and alcohol and nicotine to help. So things that decrease blood flow.
Okay.
All the deets on fibroids. All the deets. Just tell me everything.
On your ovaries?
You
That
know.
was my question. What fibroids?
I'm guessing. So endo fibroids. Give me all the
that's what I
deets
put.
on endo fibroids.
So fibroids is just like a collection of tissue. Like a fibroid or like a cyst or something. It's like Is it a cyst on an ovary? Is it endometrial fibroids? Yeah, that's a really vague, all the deets. I don't know what deets you want, but
if that was you, comment down below,
Yeah,
or
tell
send
us
us
more.
an email, or send Joy an email.
Yeah, and if we ever do a follow-up, we can always ask it again.
Yeah.
But the big thing is really the concern with any kind of fibroid is it can wrap itself around different things, and that's not good. Like wrap itself around your ureters and you have urination problems, or wrap itself around your ovaries and you have fertility problems like endometriosis, which I know we're going to get to in a little bit, or wrap itself around your lungs, or it can get into your brain. Like it can get endometriosis can get into some really weird places.
Thank you so much for watching. We have many more follow-up questions coming with Joy in the future, so make sure you're subscribed to our channel, ring the bell for notifications so you never miss out on a new video. Like and comment. If you have questions for Joy, her contact information is below. So I hope this was educational for you. She is a trained professional, so you can trust everything that she has to say. Whereas Caitlin and I just tell you our opinions, and we always have to give a disclaimer like we're not doctors.
Or really anyone that knows anything.
No, we don't do that.
We are two women without shame on the internet. That's
Yes.
really what it is.
That's what we
pretty
need more
much.
of.
And so I'm very excited about the validity of this video.
Me too! It's like science.
So thank you very much
Thank
for
you.
being
You're
here.
welcome.
Yeah.
And so watch our last video, watch our next video, watch
all the
videos.
We've never done this with a guest!
We've never had a guest. You're our first ever guest.
I'm so excited.
Other than Mike.
Other than
So
Mike,
much.
which like
He really doesn't
he
count.
gets rankled into it.
Yeah.
He's literally like,
As
I
you
don't
should.
want to do this. So normally we ask a weird question if you've made it to the end, but really I think it's your turn. If you
I
have
agree.
a question that you would like answered, write it down below. If we do a future video, we can always ask, or we can forward it, to Dr. Joy and see if we have an answer for you.
Okay, so we're gonna go eat some lunch and then film parts 2 and 3. So stay tuned for that.
Bye!